Healthy eating is a cornerstone of healthy aging, but too many older adults regularly face food insecurity. Nearly half of New York's older adults are at risk for malnutrition. For older adults struggling economically, the least expensive foods are often highly processed with added sugars, fats, and salt. Over time, an unhealthy diet contributes to lower quality of life, higher rates of chronic disease, and a shorter lifespan. But the good news is that there are resources to make healthy food more available in New York State. In fact, the New York State Office for the Aging and its network administer the largest nutrition program in the nation, with more than 23 million meals served each year to nearly 300,000 people. In this special edition, Aging Together New York Food as Medicine Town Hall, we'll spend the next hour sharing resources for finding nutritious food, information on the science of nutrition as it relates to aging, and how improving diet can lead to a healthier and higher quality of life. To start our conversation, I'm joined by Beth Richardson, Food as Medicine Manager for the Food Pantries of the Capital Region, and Greg Olson, Acting Director of the New York State Office for the Aging. Thanks so much for joining us.
Thanks for having us. It's great.
I want to get started with sort of a definition of what is food insecurity. What does that mean?
So food insecurity is not having access to enough food to maintain health and quality of life. And then specifically, nutrition insecurity usually goes right along with that. And that's looking at having the correct foods to really enhance your health and maintain a healthy lifestyle, not just being alive, but also thriving.
And Greg, what are we looking at in New York State? What's the situation for older adults across New York?
Well, it really depends on the county. I mean, you would think of differences between suburban, urban, rural areas, and there really is no rhyme or reason. So for older adults, it could be in some counties anywhere between 12% and actually 39% who are food insecure. And I know you talked a little bit about the economics. That is a major factor, but it's not the only factor. Food deserts, et cetera, transportation, oral health is a huge deal that we don't talk about very often. So there's those types of factors. But as you said earlier, there are a lot of resources that people may not know about or people may know about, but for some reason, don't apply for those benefits. And hopefully we can talk about that.
Yeah, and I know you've been working on the master plan for aging in New York State. To what extent is food and access to food a part of that?
Well, it is a part of it, and I think when we talk about the master plan for aging in New York, it has aging in it, so there's a focus on aging. But what we know is you begin aging the day you're born. And so if we can have an impact on providing, like in this year's budget, there's free school meals for any student. That's really, really important to help you learn. But if we were able to impact the curve earlier on, whether you're a child, middle age or older adults, it's going to have a positive impact over time. So of course, nutrition is a big part of the MPA, but it also is with other initiatives that tie around that. So there's the prevention agenda, which is, again, a whole public health approach to making people healthier. And a lot of that's in the community, as well as what's called health across all policies, which is that every agency, whether it be aging, children and families, housing, all has a stake, because the built environment is a lot of reasons why we have food insecurity today.
And the reality for older adults is, you may be thinking school meals, but there's grandparents or family members that are caring for younger family members. And so, food for those kids may actually mean more access for food for the older adults in their lives.
You are spot on. There are two things in the budget that I highlighted this year. One is the increased child care tax credit, and the other is free meals. And I remember getting a question from a legislator: why would you put that in your budget testimony? It's exactly the point. We have 350,000 grandparents who are the primary caregivers of the grandkids, whether it be incarceration, death, fentanyl, whatever it might be. So you're right. Not only does that help keep cash in their pockets, but if you claim your grandchild on your taxes, you can get a tripling of the child tax credit. Again, people don't normally think about that.
What does this look like from the food pantry's perspective?
From the food pantry's perspective, I know that last year alone, we're a coalition of 72 pantries throughout the Capital District, and we served just over 9,000 seniors, individual seniors, and they came on average of 6 times a year. And so we're seeing that reliance on what is supposed to be an emergency food system, not necessarily something to go to regularly for your daily or weekly shopping, but it's being used regularly by quite a number of people, over 9,000. And going off of what Greg was saying about school lunches, that cognitive development and protecting against cognitive decline starts in childhood. So addressing food security at any age becomes helpful for older adults.
In New York, how does it stand against other states in the country? Do you have a sense of where you are?
In terms of food insecurity, you know, I think nationally the percentages are just under 10%, and I think we're pretty consistent there, but I think that there's going to be differences depending on where you go. So I think we think less of it that way and more of how are we doing. How are we doing getting out there to talk about the variety of things, whether it be food banks and food pantries, the SNAP benefit, our home delivered meal program, congregate meals, nutrition education, SNAP Ed, all of these things are available, but there's also other programs that put cash back in people's pockets. So it's not always has to be linked directly to
It's interconnected.
a food benefit. If we can get people who qualify, you know, if you make $2,200 a year, you could qualify for what's called the Medicare Savings Program, and we can help save people $7,000 a year. You add then the SNAP benefit. The average benefit for an older adult in New York is about $220 a month. That's another $2,500 a year, and then the Home Energy Assistance Program that helps with heating and air conditioning is another $1,000. Those three programs alone can put $11,000 back in people's pockets that can then help in other areas.
And what about the quality of food that is accessible through some of these resources and the focus of that with the food pantries in particular?
So the food pantries runs what's called a healthy pantry initiative and helps our member pantries to offer more nutrient-dense, high-quality foods as part of the healthy pantry initiative. So we're working towards providing healthier, more nutrient-dense options just as the general food that's available within the pantry, not as part of a specific food as medicine program or targeted to any sort of particular condition. It's just increasing access to healthier options.
Yeah, and for us, I mean, I'll be honest with you, I've been traveling the state for 33 years as a geriatric social worker. I cannot tell you how many home delivered meals and congregate meals that I've eaten. I've never had a bad one. There's a lot that we do to assure the highest standards. We have registered dietitians, not only within the office, but across the state that are looking at menus, doing nutrient analysis, making sure we meet those high standards, especially for things like low salt and other types of nutrient dense, and we get rewarded from that through federal funds for every meal that meets those standards. So I can't complain about the quality. I think they're really, really good.
Talking specifically about just how food is so fundamental and interwoven in people's lives and the value of those congregate meal sites, which goes beyond the nutrition to like the socialization and the relationships that happen there. We actually, in the lead up, or planning for this conversation, visited the Colony Senior Service Centers and created a little bit of video looking at the role of food in their programs. So let's take a quick look at that.
Pretty much everything we do is surrounded in some capacity around food, eating, celebrating, partaking in. And a lot of times we're experiencing seniors who are really struggling with food insecurity in the community. My name is Diane. I'm the Executive Director of Colony Senior Service Centers. And our mission is really about supporting older adults in the Capital Region. We have so many food programs, and again, we're always trying to tweak or add depending upon what the need is in the community. So we are a congregate lunch site in 6 locations, and what that means is we get subsidies that start off at the New York State Office for the Aging, and people are able to come in and have lunch with us. You have to be at least 60 years of age, and then there's a $3 suggested donation. We do about 35,000 meals a year, and that number has progressively grown since the pandemic. We're in 3 counties depending on our program. Our network has grown from probably about 20,000 seniors that we're working with to about 25,000 seniors. And these seniors that are coming are seniors often who are in some type of need. And that might be just having a good, nutritious meal, somebody to sit down with, feeling accepted and welcomed. For me personally, right now as we speak, my biggest concern is just cutting in funding, cutting in programming. I always get concerned when I read the Times Union and I see the food pantries or the food bank are having some of their programs cut. Meals on Wheels is possibly being cut. You know, the need is growing. It's not getting any less. And I'm just wondering, are we going to allow people to starve or eat less or be malnourished? That's my greatest concern. As a little nonprofit with 54 employees, we really have to partner with businesses and with the government. We all need to recognize there's that need out there.
So, you all are part of that network that allows something like what happens at the Colony Senior Service Centers to happen. Talk about the strength of that network and the importance of sort of keeping it healthy and viable.
Yeah, well, I mean, Colony does a great job. We're fortunate in this area. You got the town of Bethlehem, right? Town of Guilderland, town of Colony. So you have municipal governments that are part of the network. I think the beauty of how we were structured, and I do want to say happy birthday to the Older Americans Act. It's 60 years old this year, as well as Medicare, Medicaid, Social Security is 90. So these are really important safety net programs that have been life changers for older adults going back to the first check, which was 1951. But we are not a top-down type of agency. We are a top-down, bottom-up, and meet in the middle. So we don't succeed unless Albany County Office for Aging, Town of Colony. And so the way that we approach things is how can we partner with you, not as a regulatory agency, but as a real legitimate partner to be able to expand and provide as many services as possible, because while we're providing, for the most part, the funding and so on for communities all across the state, it's really the grassroots organizations that start with the Offices for the Aging and then the other 1,142 community-based organizations that we work with in every corner of the state that know who their communities are, know what they need, and they have the flexibility to meet those needs. And I think that that's a real unique difference of how we're structured as a state agency versus everybody else.
When it comes to these kinds of programs and like food insecurity, we're also talking about quality of life, right? Survival and also quality of life. And things like congregate meal sites are providing that personal social interaction that's so vital, especially as we age. There's this increased loneliness that happens. And so congregate meal sites are not only feeding people nutritious meals, but then also providing that social interaction. They're getting social interaction too with those delivered meals. If they're doing the home delivered meals, they're seeing that delivery person and getting at least a little bit of that interaction, which can also be helpful because some people can't get out to the meal sites.
When you think about a program like SNAP or some of the resources that you've mentioned, what about convincing older adults to take advantage of those resources and make sure that they know they're there and that they're connected to them, because they really are fundamentally important to helping you have the quality of life that you want?
Well, that's right. I mean, one of my past jobs was working for Hunger Solutions, and the specialty that I had was working with older adults around federal feeding programs. I do just want to go back to the video because we're talking about how we can address meeting older adults who have some needs in nutrition. But I really want to highlight also what I saw there is how many older adults are volunteering to make that happen.
Yeah.
And we would not have the network that we have without them. We have 1 million volunteers in New York providing 474 million hours of service at an economic value of $13.2 billion. And they're holding up 33,000 not-for-profits. So I just want to shout out to those that give the biggest gift, which is your time. The things that I had learned over time in terms of why older people don't utilize SNAP benefits, and it's not just SNAP, but let's talk about SNAP, is number one, they've been vilified as a welfare program. They're not. There's no difference between SNAP and getting your star property tax, getting TAP or Pell. It's just, for some reason, we as a society, and I didn't do this, it's more on the political side, looks at that differently because it's for lower income people. So that's stigma number one. Stigma number two is the only benefit I'm gonna get is $10. That is not true. And I went over those numbers. Number three is, well, I don't need it as much maybe as a younger family. So if I take it, then they won't. That is not true either. And so in this environment where we're seeing costs go up, labor costs go up, fuel costs go up, impacts of tariffs, and I could go on and on and on, the price of foods are going up, and the good foods are extraordinarily expensive. We've all gone to a supermarket, got one bag, and it's $80. Versus at the end of the aisle, you can get 10 oatmeal cream cookies for $1.99. And so it's not hard to understand why people are making the choices that they are. But this is a benefit that my tax dollars, everybody's tax dollars support when you're, have a fixed income after retirement and need some assistance, and it's nothing to be ashamed about.
Absolutely. And do we have the resources in New York State to meet the demands that are there?
Well, those are federal programs, so SNAP is federal. But as long as we're talking about that, Congress has proposed to cut SNAP by $300 billion. Now, that's a proposal. It still needs to be negotiated with the Senate, and that's kind of how it works. But I think from our agency's perspective and our network's perspective, we're not sitting back and waiting for that to happen. We are proactive in trying to let the communities know not only what's being proposed, because it hasn't happened, but there's a lot of those types of things, like eliminating all elder abuse funds, eliminating adult protective services, the long-term care ombudsman program. So we all have an opportunity over the next 4 months that if we don't agree with that, we need to be a part of democracy.
What we're seeing already from at the food pantries level is that the food bank is not receiving as much food from USDA sources, so the food pantries don't have as much either. So when people are going there to find food and emergency food assistance, it doesn't exist in the same capacity that it did before.
Could you talk a little bit about the difference between a food bank and a food pantry?
Absolutely. So think about the food bank as a warehouse, right? And that's where we have large shipments of food come in, typically, historically, from USDA, as well as some local agriculture throughout the state that gets sent to the food banks. And then food pantries can go and get food, buy food, truly, from the food bank. So your food pantry is purchasing their food from the food bank. Sometimes some of it is free, but there is a purchase there most of the time. And so where the food pantries for the Capital District comes in is to help with that connection, right? Because somebody needs to get the food from the food bank to the actual pantry itself. So sometimes we do provide that logistic service of transporting the food.
Yeah, and one of the, again, and you could talk much more about this than I can, supporting local agriculture and then the food banks through Nourish New York has been a huge boost of revenue to exactly what Beth is talking about. And I think, we were fortunate in this year's budget to receive an additional $52 million in our budget that'll go out again, but we can't fill, and we don't know what these are, these huge federal cuts, because $90 billion of New York's budget comes from federal sources. We're not going to lose $90 billion, but if we are losing, USDA funding, if we're losing home delivered and congregate meal funding through NSIP, which is a different type of program, I don't know that state government can backfill those.
For folks that are watching this and want to know a little bit more about what resources exist in their community, in their county, across the state of New York, where can they go as sort of an open door, single point of entry to find out more information?
You couldn't have teed that up any better. So we have in New York State kind of a one-stop shop, and it really doesn't matter. We provide over 23 core services everywhere, and people don't need to remember what they are, but they need to know, where do you start the journey? And that's through our local county offices for the aging or New York Connects, which is 1-800-342-9871. And that will start. And they will have connections to NOAA programs, nutrition outreach and education programs to help with, SNAP benefits in addition to what we do. They should have a connection to, the Emergency Food Network. I mean, some of these things are online, but as we were talking about earlier, older adults use tech at the same rate as everybody else, but there's still going to be pockets of individuals in all age groups that just don't. So not everything can be virtual. Not everything can be wired. You need to be able to talk to a human being, and you will be able to do that if you call our offices for the aging.
We will reinforce that New York Connects resource throughout this conversation. Beth and Greg, thank you so much for setting the table for our conversation. All right, so we've learned about the realities older adults face regarding food insecurity and some of the resources available for finding nutritious food. Next, we're going to talk to two registered dietitians who, among other things, are reaching New Yorkers through content creation on YouTube. Take a look.
Older adults are just older people. And nutrition education is important in the entire life cycle, and we teach the foundations of nutrition through SNAP education.
Hello everyone, my name is Wendy Beckman and I'm a registered dietitian with the New York State Office for the Aging at SNAP-Ed New York. We are tasked with educating older adults with the SNAP-Ed principles, which are how to eat healthy on a budget. Today, I'm going to be making roasted potatoes and apples with chicken sausage. What's Cooking with NYSOFA started during the pandemic. The communications team at NYSOFA came to us for SNAP-Ed and asked if we might be interested in sort of upping the production of that program a little bit more, because it was doing very well on our Facebook page and on the New York State Office for the Aging YouTube channel. I love these one-pan meals because it really does save time on cleanup. I think a big challenge with trying to eat healthy on a budget is that healthy foods are expensive, but there are ways to mitigate some of that by using different kinds of products, by purchasing fruits and vegetables when they're in season, by using fresh, frozen, dried, or canned. I hope this recipe gave you some more ideas on how to incorporate more vegetables and lean protein into your diet. The goal of the New York State Office for the Aging is to help older adults stay at home for as long as possible. Nutrition is an integral part in keeping people healthy. It's an integral part in keeping older adults at home for as long as possible.
Welcome, Wendy Beckman and Elizabeth Irish. We're so pleased to have you here. Now, you're both registered dietitians who work as nutrition consultants with the New York State Office for the Aging. Talk a little bit about what your role is and how you work with older adults in New York State.
Well, I am the SNAP-Ed program manager for NYSOFA. We serve older adults 60 years and older throughout New York State. SNAP-Ed is currently in 26 counties, the 5 boroughs of New York City, and 2 tribal nations. So we have a big, span of services, and I manage the program managing along with, many of our other staff members. Wendy was my predecessor. She's always my go-to for questions that need some history, but it's a great program, and we have educators throughout the state. We have 9 regions. Each region is led by a county office for the aging, and they provide programming not only in their region, but they also try to do programming in 2 or 3 counties near them. So we have lots of registered dietitians throughout the state doing programming for SNAP-Ed.
Wendy, what about you?
So Greg Olson was here earlier, and he spoke about the nutrition programs that are funded through the New York State Office for the Aging. And one of those programs is congregate dining sites, and the other program is home delivered meals. And it is my job to go travel throughout New York State and visit different counties. And we talked a little bit about the nutrient quality of the meals. And in the Older Americans Act, it is written right in the legislation that those meals need to meet at least 33 1/3 of the dietary recommendations for Americans. So I look at the nutrient analysis, I make sure that the kitchens are operating correctly, so it's really nice. I get to go out throughout the state and see people who are benefiting from the programs that we provide.
As a nutritionist, SNAP educators, right? Maybe not everybody may be eligible for SNAP, but everyone 60 and over can access information from a nutritionist that could perhaps be helpful for them, correct?
So individuals who are 60 and older can contact their county office for the aging, and they are eligible to get individualized nutrition counseling, even if they don't visit the congregate sites, even if they don't get home delivered meals. So that is correct.
And how would someone get connected to their area agency on aging?
So again, Greg mentioned New York Connects, that phone number. You can call the New York Connects number, and the person on the other end of the line will ask you what county you are in, and they will directly contact the county office for the aging for you, give them your number.
You talked about keeping up on sort of the dietary guidelines. How often do those kind of change?
They change every 5 years. They have been already drafted. They're ready to release. We just don't know when they'll be released.
I remember the food pyramid, right? And then it switched to MyPlate, right? And which seems like a little bit more of a simpler design that shows you sort of portion size, perhaps, about what you're supposed to be eating. Talk us a little bit about, how do you describe MyPlate to someone?
MyPlate is a picture of how you should eat every meal. Sometimes, I say from personal experience, maybe I won't do my food choices exactly like my plate. Maybe I didn't get to the vegetable for breakfast. I'm not a fan of vegetables for breakfast. I know I'm a dietitian, but that's not my thing. So I might have that vegetable as a snack later, maybe some carrot sticks with some hummus or something. But it gives you an idea of what a meal should look like. And that's, assuming you're eating 3 meals. But it's also portion controlled, so you're not overeating or undereating. People assume older adults might be overeating, but there's plenty of older adults that maybe are challenged to eat enough too. So it works, in different ways for different populations.
Researching for this program and looking at like half of older adults in New York State are at risk for malnutrition, but malnutrition isn't just undernourishment, it's also perhaps overnourishment. Talk a little bit about the definition of malnutrition, how you see it in the communities that you serve.
Well, overnutrition happens with many populations. We live in a country that has an abundance of processed foods, and you might get overnutrition from eating too many calories, too much saturated fat, too much sodium. So we try to guide people to pull that in and eat, the adequate amount of, different components of the diet. Not under, not over, in the middle. Moderation is a hard concept for a lot of us, and that's kind of one of the foundations of nutrition, and that's one of our aims is to help people achieve that.
And with overnutrition, if you want to call it that, that sometimes can happen when individuals eat too many highly processed foods. Now, not all processed foods are bad, but the more highly processed foods can be lower in nutrition and higher in calories. So they have more of the things that you would like to limit in your diet, and they have less of the things that you really should try and get more of in your diet. So less fiber, they have less vitamins and minerals, those types of things. Whereas less processed foods tend to have more of those things that you want more of. So the overnutrition can happen where it's more calories, but actually less nutrition. They're nutrient deficient foods where they don't have a lot of vitamins and minerals and fiber in them.
When someone goes to like a congregate meal site, and they're able to get a properly designed meal that is nutritious, that's one thing. That's an easy way to get a great quality meal. But if you're going into the grocery store, are there any tips like in terms of looking at nutrition labels, that sort of thing, to look for those key points of like fiber content or fats or sugars that you try to help people to know, like, is this even healthy? How do you determine that?
This is one of the goals of the SNAP Education or the SNAP Ed program. We have educators throughout the state that teach workshops that are specifically designed to help people make healthy choices. We have small groups of people. The educator might meet with them 4 times over the course of a month, and she will go over how to label read, how to budget, basic nutrition based on my plate and the dietary guidelines, plus a whole lot more. And they make it fun. There's also a physical activity component to most of our curriculum, and the educators are wonderful. So it's enjoyable. You're learning about how to do these things in an enjoyable way.
Yeah, I don't know if you have any particular tips when it comes to like reading nutrition labels or looking for a target number for fiber content?
Usually looking for labels that say that a food is a good source of fiber. Everyone has different fiber needs. So if you look at something, it's hard to give you a specific number, but looking for labels that say that they are whole grain, not just wheat, because wheat can mean white flour. So whole wheat and whole grain items. When I used to teach individuals in the community, I used to tell them to look at the bread, and if it had 3 grams of fiber or more per slice, then it was probably a good source of fiber. Now you have to be careful because they will try and trick you, and it'll say 3 grams of fiber on the label, but then you have to look at the serving size. So you have to look at, is that 2 slices of bread? There's 3 grams of fiber in 2 slices of bread, or only 1 slice of bread. So you want to look at those types of things. Fruits and vegetables, most Americans don't get enough of those. Beans, legumes, nuts, and seeds are all excellent sources of fiber.
You always want to increase your fiber gradually, though.
That is correct.
Doing it too quickly can have some not so pleasant results. But yeah.
Talk a little bit about unique needs of older adults when it comes to nutrition.
Older adults have higher protein needs, but they're not extremely high compared to the usual American adult diet. Most Americans eat enough protein. We actually eat probably a little bit more than we need, according to the dietary guidelines and the research. But if an older adult can't maintain that because of some challenges, that's where our educators come in. They try to explain, maybe some cheaper, less expensive sources of protein, because protein can be very expensive. Older adults sometimes run into challenges that they may not have had when they were younger. They may have a more limited budget. So again, our educators help them find maybe some alternative protein sources. They might have some increased physical needs. They might not be able to stand for a long time preparing foods. They might have difficulty chewing. That can be a barrier. They might just not have the preference for some of the protein foods they used to eat. I know myself, the older I get, I'm not as crazy about the chicken and the whatever that I used to eat, even fish. I'm just not that crazy about it. I prefer some of the vegetarian sources. But our educators help people identify those sources and know what to do with them. They use a lot of SNAP-Ed recipes. SNAP-Ed recipes are amazing because they're nutritionally balanced. They have fewer ingredients than a lot of recipes. They're easy to modify if you only want to have maybe 1 or 2 servings as opposed to 5 or 6. When you're an older adult, a lot of times you don't want that 5 or 6 servings. And our educators explain how to adapt the recipes, and they demonstrate the recipes. You can find a lot of SNAP-Ed recipes on snapedny.org.
Your YouTube show, What's Cooking with NYSOFA, those are all SNAP-Ed recipes. Y'all both, your Ask the Expert Nutrition Edition on the NYSOFA YouTube channel, you've gotten a lot of views and a lot of response. Has that been in some ways a surprise in terms of like the need, the hunger, if you will, for this information?
It was to me. So we started doing the cooking demonstrations and the Ask the Experts Nutrition Edition during the pandemic. When we were trying, the communications team at NYSOFA was looking for ways to engage older adults, especially during the pandemic when people were being encouraged to stay at home. And we know that social isolation is a huge problem for older adults, and it became more of a problem during the pandemic. So it was sort of pitched to me that we should, through the SNAP-Ed grant, do a cooking show. And I was very reticent, I was very hesitant. But we started streaming it live from my living room. I used my iPad to stream it live to Facebook, and it was very popular. I was shocked, especially since it was sort of a very low budget way that we were filming it. I had a little stand for my cell phone so that we could have an overhead view of what I was cooking on the table. And after about 2 years of doing it that way, the communications team at the New York State Office for the Aging suggested that we sort of up the ante a little bit and increase the production value. And we started filming those cooking demonstrations ahead of time. And that allowed us to add some graphics and some music and make it look much more professional. And we do that in conjunction with the New York State Office of General Services, and they make us look amazing. So I use all SNAP-Ed recipes for that program. So that means that they are lower in sodium, lower in saturated fat, much higher in vegetables, higher in fiber. So all of those things put together can help people to learn how to eat healthy on a budget, which is the goal of SNAP-Ed, and to increase your vegetable and fruit consumption and things like that. So we did that. We started the Ask the Experts Nutrition Edition, also again live from my living room. And when Lizbeth joined our team, she took over management of that program, and she does it to this day. She takes questions from the audience and she interviews the nutrition educators from our SNAP-Ed program who are throughout New York State, and she gets to talk to them about their expertise as well.
Yeah, it's a great way to highlight the skills and the knowledge of our educators so that everyone can see what they know and, a little snapshot of how they teach.
congregate meal sites, home meal deliveries. Those are great ways to get high quality meals, and you can reach out with New York Connects to get connected with some of those resources. But let's talk about some myths and misconceptions, things that you try to educate folks on, ways to get food that is both healthy and fresh and good tasting. So let's talk about like canned foods, frozen, dried. Like what are the typical the advice that you give around those kinds of foods?
So I hear a lot that eating healthy is expensive, and in many instances that is true. But with the SNAP-Ed program, we have certain messages and certain teachings that we rely on. So one of them is make half your plate fruits and vegetables. And some people feel intimidated by that because they think, oh, that's too expensive, I can't afford that. But one of the other teachings we have is fresh, frozen, canned, or dried. It all counts towards making half of your plate fruits and vegetables. So it's really okay to use canned vegetables. It is okay to use frozen vegetables. One of the other things we teach is to try to purchase fruits and vegetables that are in season. So if you are able to go to a farmer's market or if you go to your local grocery store, trying to purchase items that are in season. In New York State, an easy one is apples, right? We all know that apple season is September through October, November, December of the year. And you can get apples all year long, but they're freshest during that time of the year because that's when the apples are growing. And so those things happen. There's a lot of surplus at those times when those items are in season. And so sometimes the prices go down. Look for sales. I always buy things on sale. Things like apples, I look for the apple on sale. There's not a lot difference between the different apples. So things like that can help people to stretch their food budget. We teach people how to use up their leftovers, because if you're not wasting food, you can stretch your food budget that way. That's another thing that we teach.
And sometimes people question the frozen and canned items, like, well, don't they have sugar and don't they have salt? There have been studies, actually, that prove that you can decrease the sodium in a canned vegetable by rinsing it. Rinsing it well, and not just, but also a lot more vegetables are made without salt now. So, even store brands you can find with no added salt. When it comes to canned fruits, even just rinsing the syrup off. I mean, if you can't afford the ones that are packed in juice or even light syrup, sometimes those are a little more expensive than the ones in heavy syrup. You can still rinse off the heavy syrup, and you're still ahead of the game. You're still getting the nutrients in that fruit or vegetable. And frozen vegetables and fruits are harvested at their peak, so you're getting really high quality fruits and vegetables when you buy them frozen. Sometimes they're fresher than the fresh, depending on how far that fresh vegetable traveled to get to the store that you shop at.
Wendy and Elizabeth, thank you so much for joining us. It's been a pleasure talking with you.
Thank you.
Thanks for inviting us.
Now, we know that an unbalanced diet can contribute over time to an increase in chronic disease and poor health outcomes related to malnutrition, but can a healthy diet improve one's health and quality of life? To explore what a food as medicine approach looks like in practice, I'm joined by Dr. Alexander Ford of Community Care Partners and Stacy Pettigrew, Associate Professor and Director of the Collaboratory of the Albany College of Pharmacy and Health Sciences. Dr. Ford and Dr. Pettigrew, thank you so much for joining us. Dr. Ford, I wanted to start with you. You're a DO. Folks may be familiar with MD, but what does a doctor of osteopathic practice mean?
Absolutely. So DO stands for Doctor of Osteopathic Medicine. In the United States, there's two ways to become a physician. You can get a DO after your name or an MD. MD is uncommonly affiliated with allopathic. So you might hear that word interchangeably between MDs and allopaths. They're the same thing. So we get the same basic 4 years of medical training, but what's unique about a DO is, in addition to that, we also have hands-on manipulation called manipulative medicine. That's called OMM. And there's a lot of alphabets, right? But again, that's what really sets us apart. So the art of osteopathic philosophy is that we not only study the body, but we look at it as a unit. So when we're doing our osteopathic labs, we're looking at the body from head to toe and understanding the nuances between structure and function with the body and how our hands might be able to provide a non-pharmacologic, non-surgical intervention and help the body ultimately heal itself in some situations. So again, when we have our allopathic colleagues there doing their same lectures as we're learning, so the basic medical training is the same, but then we have that other modality that we can use when necessary or when it complements our additional training, which is awesome.
A lot of the healthcare system in the U.S. is dealing with symptoms, you know, whereas the approach that you take is a more systematic one, I suppose?
Absolutely, absolutely. So the DO philosophy is, again, more holistic, whole body. So when I have a patient for an initial encounter, let's say it's a physical, I'm going over their environment, you know, their finances, their social economics, because that's integral to me being as impactful as possible as a primary care physician. I tell my nurse that when they're rooming my patients, right, that medical appointment starts from the initial standpoint of them walking into that building. I'm looking at their gait, AKA how they're walking. Are they, do they look like they're favoring a certain side of their body versus another? Are they using a ambulation device as far as a wheelchair or walker? Why are they doing that? So just, you know, more and more and using our osteopathic lens to get to the root cause and ultimately prevent the disease whenever it's possible.
And Dr. Pettigrew, you know, it seems to me you take a similar perspective of looking at systems and not necessarily just an individual choice or something around the foods you eat, but looking at environment. And so talk a little bit about the work that you do from a public health perspective.
At the Collaboratory, so the Collaboratory, we're a health resource, a community health resource center that is operated by Albany College of Pharmacy and Health Sciences, and we operate in partnership with Trinity Alliance's Community Health Worker Outreach Team. And so we have a range of different programs that we offer. The community health workers offer wraparound services to address social determinant of health needs and helping connect people with insurance and primary care and then housing, transportation, food. And so, and then we have a public health pharmacy team that also operates there that does medication reviews, and we have a hypertension program called Connected Hearts, which helps people get control and monitor, and it empowers people to really monitor hypertension and prevent its progression. And then we also are launching a new cohort very soon of our Food as Medicine program. And this cohort, we're looking to do a study with it to try to document the impact that it has on people's health, and can we use healthy food deliveries, weekly deliveries of healthy food for people with either hypertension or type 2 diabetes or both, and document that it is slowing the progression of those chronic diseases.
It's interesting to sort of look at, everything is interconnected, right? Like we can't just say, well, we just want to focus on diet. We look at the environment, that sort of thing. I'm thinking about what Greg Olson said earlier in the program. We're talking about, like, some of the resources with home heating, are connected to helping then you have more money for food or whatever your needs are. So talk a little bit about just the concept of food as medicine and what you are trying to accomplish with that.
The food desert was mentioned. And so I think access to food is a really, really important issue. And transportation, do you have a car to get to the grocery store? Is the grocery store close to you? Is there one that you can walk to in your neighborhood, or are there only corner stores with ultra-processed foods? What access, besides just being able to afford healthy food, can you get to it and buy it? And so the Food as Medicine program, we're running, we have, like I said, it's people with chronic disease, and we're giving food to the whole family as well, not just the individual that's enrolled in the program. And we're doing this in conjunction with Trinity Alliance's food pantries. And so each week people will get a box of healthy food, and that is enough for some of the meals for the week, not everything, but to take some of that burden away. And then we're going to include recipes, and we're going to be checking in with people and have a holistic look, connect them with the community health workers if they score in any social determinant of health needs, connect in a medication review if that's desired, and so and then we're going to do A1C, so blood sugar, long-term blood sugar levels testing, and then also lipid panels to see about blood lipids at the beginning and the end. So can we move the dial in any of these measurements by providing, a stress-free, delivered to your door box of healthy food for your family for a week, each week for 6 months.
Dr. Ford, what is the relationship with diet and nutrition and food when a patient comes into your office, and what part of their care is that portion?
Sure. It's the crux of my patient visits. And what's beautiful is I've been at my practice long enough where clients are deliberately seeking me out because I'm one of the few physicians in the area that also has that extensive nutritional background. So I have the reputation of leading with the nutrition prescription whenever possible. And instead of a pharmaceutical one, right? I understand medications exist for a reason, but when we can, let's try to enhance what we have, and again, augment our parts within our body, which we were born with, which I think is beautiful. So from the initial start of a appointment visit, I'm going over medications. I always do a dietary recall. So I like to get more context about dietary patterns, affordability of foods, who's doing the shopping, and then also nutritional literacy is extremely important. Just because somebody knows how to read a book does not necessarily mean that they know how to read a food label, and they go hand in hand. So again, it gives the patients a lot of ease and comfort that, again, I'm not leading with that prescription pad, and I want to have more of a conversation to see how we can get the buy-in together, and I can help quarterback your health in a comprehensive, holistic manner.
For folks who aren't your patients,
yes,
but what could they ask their own medical provider, care provider, to help maybe in navigating some of these situations?
Great question. So again, as we age and go through the different developmental or life stages, the nutrient demands on our body are going to differ, right? For instance, so if we have a pregnant patient, I'm making sure that I lead with that conversation on folic acid and making sure that they're supplementing that within their diet for the unborn baby. So again, for our older patients, I believe that one of the other panelists was mentioning protein, right? And how that needs to be a focus of emphasis on the older adults. So there's a condition called sarcopenia, and that's natural loss, progressive loss of muscle mass, lean body mass as we age. And so when I'm looking at my patients for maybe a Medicare wellness visit, I'm asking them about the sources of protein, the differences between animal protein, right, from a meat source and then from a plant source. And that emphasizes the fact that, okay, I don't have to eat a steak and potatoes every night to be able to get my adequate protein. So there's an art to the science of medicine and broaching that conversation, and then again planting that seed that, okay, there is a stylistic option, and I don't have to restrict myself to this limited amount of foods to stay alive and perform to my optimum and continue to age gracefully. So it's a lot of education, insightfulness, and collaborative effort.
One of the things about the food as medicine work that you are doing as well in the community, what you're trying to learn, are you able to get some insight into how successful or impactful these things will be? Talk a little bit about what you are trying to achieve with your study.
We're going to do, we have a pre-survey and a post-survey, and then we have the biometrics pre and post. And so we'll do the, like I had said, the A1C and the blood lipid panel, blood pressure, and BMI and waist-hip ratio, and then do those again at the end. So can we move these very, calculatable measures? But we also have a survey that looks at a lot of the things that you have in your intake. So where do you get your food? What types of food do you eat? What does your diet look like? What access do you have access to kitchen appliances, and do you know how to use them? Do they work? And things like that. And then we're also going to do some mental health screening in there as well. And so then we'll have our 6-month intervention, and then we'll do them again at the end. and we'll see pre and post, have we moved the dial at all?
And anecdotally, I mean, I guess you have patients, like, do you see that you're able to perhaps, more easily manage chronic disease or maybe reduce medications?
Sure, absolutely. So again, like I said, more of my patients and clients coming to me intentionally are seeking me out because they, at minimum, want to decrease some of the medications if it's reasonably possible, or thwart or prevent that prescription for a medication. So yes, for instance, I do have a patient that had high blood pressure. It was stage 1, so it was at the lower end, but it was technically hypertension. And we started her on a low dose blood pressure medication. But again, knowing her occupation, she was in the middle of primaries, and she works in like the legislative aspect. So it was very high stress. So I started on a low dose intentionally because I was confident she could get off of it once that season kind of quelled down. I also talked to her about the importance of diet, exercise, and I emphasized and targeted nutrients that could help naturally lower her blood pressure. Specifically, I talked about beetroots, and I also talked about fruits and vegetables that are robust in calcium, potassium, magnesium, which have studies that have supported the relaxation of blood vessels and translating to lower blood pressures. And when I saw her for a 3-month follow-up, she was completely normalized. She had been off the blood pressure. She's discontinued it herself after 4 weeks. I was happy, she was happy, and again, she was able to do it by using food as medicine.
Talk a little bit about like the relationship between adequate nutrition, good nutrition, a balanced diet, and the quality of life that you want. I mean, I know like there has been data that linking fall prevention, and that inadequate nutrition can put you at more risk for falls. This is really about helping someone have the kind of quality of life that they want, whatever stage of life.
Absolutely. So again, when I have my initial visits with patients, I want to be conversational. I'm on your team. I'm your primary care doctor. I'm taking care of not only you, but every component of your family. So I need to know, right? And with that being said, I want to know what's your relationship with nutrition. Unfortunately, in Western culture, there's a lot of stigma around health, right? There's a lot of confusion, especially with social media. You have TikTok, you have Twitter, aka X, saying something else.
A lot of myths out there.
Right.
Yeah.
You have blogs, that Reddit, things of that nature. So you're getting inundated by multiple sides, and you really don't know what is true, what's real, what is conducive to my health, and what can be deleterious as well. So I explain to my patients that I'm a proponent of a health span, right? And I explain the difference between that and a lifespan, right? If one of your goals, and I ask about that, is to watch your son or daughter graduate college, what does that visually look like? Put me there. Do you want to be standing, taking photos with that person? Are you going to be wheelchair bound? Are you going to be using that cane? Are you going to be able to ambulate the stairs, in that gymnasium? When you put that person there, it makes it real to them. So when I'm having those conversations, for instance, about smoking, and how it can increase and progress to worsening COPD, emphysema, things of that nature, and you might need that oxygen tank while you're in that gymnasium. That's where that light bulb goes on. And I use the same thing again with the foods that I'm teaching. If I have a truck driver, I really try to emphasize, how about you plan out your meals? Why don't you pack? Because with you going to these rest stops, the high saturated fats, they're going to compromise your heart disease, not now possibly, but 5 years, 8 years down the line. And maybe your daughter's pregnant. Do you want to be able to see that unborn grandchild? How does that really look like? So I really try to play the long game with my patients, and that's ultimately the root medicine and that flair that gives osteopaths that differentiation.
Dr. Pettigrew, what about this idea that, so much of diet and food, we think of it maybe as individual responsibility, and yet our environments don't necessarily do us any favors when it comes to those access to healthy food, that kind of thing. So what about public health and sort of taking that environmental approach versus like saying that this is just all about individual choice?
When we think about population-based interventions, again, it's programs like the ones that like SNAP and different things that are helping people purchase food, and then there are different programs that can help transportation to food sources, and so I think all of these are very important. Increasing not only not only the financial aspects, but the transportation and where, where our grocery store is located, where our food pantry is located, and farmers markets and things of that nature. I think Nourish New York too, and we think of, which is a program that helps get food from New York farmers and support the New York buying of the New York farmers' food and having that distributed for free to people through the food pantry networks and food banks. And that's just a win-win because we're supporting our farmers and we're getting healthy, like fresh fruits and vegetables out to people, and meat and dairy. And so just working on this access, I mean, we think about the food system and I can go on and on about, but it's broken. It's so broken. And from farmers being bankrupt, the small farmers being bankrupt, to the amount of pesticides and different petroleum products that are being put in, on our foods and our crops, to the distribution systems. We have chickens. Do you remember during the pandemic when there was a few main sources where chickens were being processed and workers got COVID, and we thought we weren't going to have meat. Like everybody, there was a shortage of meat because it goes through these narrow pathways. And so I think that, and then we throw away so much food too. All of it really, there's a bigger systemic picture that we need to look at. I do believe.
Well, I have to say we've run out of time. To learn more and to share this program with someone you know, visit our website, wmht.org/aging together. Thank you for watching, and thank you both for joining us.
Thank you.
Thank you.
Appreciate it.
Mm-hmm.